I'm going to go ahead and get started. My name is Julie Babbage. I'm the Executive Director of the Diabetes Patient Advocacy Coalition, and welcome to the Massachusetts Diabetes Advocacy Forum. This is our fifth state for the Diabetes Advocacy Series, and we're really excited to be coming to Massachusetts because a lot is happening in this state. I'm going to pass it off to Paul, who's going to introduce everyone officially. He is the guy in the state and really the country for diabetes advocacy. He is a son of Massachusetts and has had audiences with state representatives, members of Congress, Governor Baker, and past governors. He was even invited to the White House to speak on diabetes. That's the picture of him here, and the importance of affordability and access. So Paul, thanks so much for joining us, and I'm going to turn it over to you.
Okay, thank you. Julie, thank you. And thanks to DPAC, a formidable force in advocacy, improving the lives of people with diabetes. I am truly honored to be one of their many volunteers, and some of the volunteers I know are on this call today. We're thrilled that you're here. Advocacy is the way that you and I, our family and friends that care about us living with diabetes, absolutely improve the environment of education, access, affordability to the medicines, the technologies that we and our educators and prescribers recommend for optimal health. I began my advocacy career about 50 years ago. I've lived with type 1. It'll be 60 years in about 5 months. And I've been blessed. I've been blessed that key people have volunteers have helped me. Margie Lawler, who I think is on the call. I think Martin Drilling is on the call, and countless others have made the difference so that we've been able to improve lives. Julie mentioned that last summer I had an opportunity to speak at the White House. I was thrilled to do that. I wasn't thrilled to be traveling in the COVID time, but Julie and her colleague drove over several hours. I drove down from Boston. We kept it safe. And we just reminded everyone that the expense of so many of the medicines and education put diabetes optimal care out of reach for so many of the 34 million Americans. We need you and everyone to be taking care of yourselves. Vaccinations, we know, are a priority for people with diabetes. It was DPAC that helped lead the charge, yes, with other groups. They are absolutely bridge builders and with other individuals, so that the CDC finally recognized that diabetes was a major concern and got a priority ranking, and Governor Baker agreed to that just a few weeks ago here in Massachusetts, so we're thrilled. Advocacy has to be a positive force in changing and improving lives. Julie, her team, DPAC, embrace that. The two senators that are on the call with us today, I couldn't be happier and more proud of them for stepping out of their busy lives and saying to each of us today, I had to be here. This is a priority. So thank you, both Senator Sears and Senator Lovely, for being here. Please, if you've never done advocacy before, get started with us, because we're going to help to manage the costs of medicines, education, technologies, and diabetes so that it is available for all of us. And we are going to join forces to improve the health and lives of everyone living with diabetes. I've said enough. I'm going to listen to our distinguished MCs who also are jumping on soon. But let me right now turn it over to our Executive Director of the DPAC group, Julie Babbage. Julie, thank you so much.
Perfect. Thank you for that introduction, Paul. I really appreciate it. And it's so nice to have a nice accent that's clearly quite local to the Massachusetts area. So we really appreciate that. And we appreciate all that you've done for people with diabetes. And it has been a lot. We start today with an introduction and then get into our legislative panel with two senators from Massachusetts who are working on a variety of issues, including health and diabetes. And that's Senator Joan Lovely and Senator Julian Cyr. A note about our audience, a little bit more than half of you, about 52%, indicated when you registered that you have not met with a legislator before. So after today, you can say that you have. We will then get into our Advocacy 101 segment, which is going to highlight 5 or 6 key bills that are active right now in Massachusetts. So there's a lot going on in the state for the diabetes community to be excited about and to be monitoring. And then last on the agenda, we'll wrap it up all in just about 90 minutes. Let's transition into our first panel, which is the Massachusetts Legislative Overview. And I'm going to introduce our moderator while our panelists and moderator turn on their cameras so that we can have them with us on the screen. Ed Hawthorne is the vice chair of DPAC's affiliate organization, the Diabetes Leadership Council. He is former chair of the board for the American Diabetes Association and has served on several other boards, including the Red Cross and the March for Dimes. He's currently the COO, managing director and partner of CE3 Solutions. A champion for people with diabetes for decades, Ed is actively involved in the state of California, where he resides with his family. So thanks, Ed, for joining us, and I will turn it over to you to introduce our senators. Thank you.
All right, well, thank you so much, Julie. And we are so excited to be in this state because Massachusetts is a leader in healthcare. For example, for instance, it has the lowest uninsured rate in the nation with less than 3% of its population uninsured pre-COVID. Health coverage is a critical topic nationally, and especially in the diabetes community. So these numbers are nothing short of remarkable and something that we should all be celebrating. For today's panel, we're grateful to have with us 2 individuals from the state legislature who work on all kinds of topics, including diabetes and the broader health policy. So I'd like to introduce them formally to you right now. So first we'll start with Senator Lovely. Senator Joan Lovely is Assistant Majority Leader in her 5th term representing the 2nd Essex District. She serves as the chair of the Rules Committee, chair of the Ellen Story Commission on Postpartum Depression, and a co-chair of the Massachusetts Caucus of Women Legislators. She earned her bachelor's degree from Salem State University and her JD from Massachusetts School of Law. Senator Lovely is a former member of the Salem City Council. And next we have Senator Sear. Senator Julian Sear represents Massachusetts Cape and Island District. In addition to his leadership role as Assistant Majority Whip, Senator Sear chairs the Joint Committee on Mental Health, Substance Use, and Recovery. And among his other committee assignments, he works on issues related to public health and health policy. He earned his bachelor's degree from New York University, and prior to his election in 2016, Senator Sear served as a director in the Massachusetts Department of Public Health Policy. So now it's well known by especially many of us in the diabetes community that everybody has a connection with diabetes. So I'd like for you to tell us yours and why you work on this important issue. And Senator Lovely, let me start with you.
Thank you, Ed, and thank you for the honor to be here today and to be with my great colleague, Senator Sear, who's really a leader in all healthy areas across the Commonwealth. I will tell you that there's a gentleman in a community where I live, and I will refer to him as Kay. And I've known Kay really back to my city council days for a few decades now. And Kay became homeless. And he started to have health issues. And Kay's a very independent individual, so he really would not avail himself to any type of resources. Tried to get him to take meals daily at the homeless shelter, an excellent shelter nearby. He just did not want to avail himself. And so as a result, Kay became ill. And what did he have? He had diabetes, but he was in complete denial. I would see him at least weekly. He had a tremendous amount of edema in his face, in his hands. His hands were just double the size, in his feet. And I'd say, Kay, have you been to a doctor? You need to see a doctor right away. And he just was in complete denial, was afraid of the medical community until he was hospitalized, frankly. And then was diagnosed with diabetes, was treated. And today, Kay is compliant. He is now insulin dependent. He has the resources to get, to get his insulin. I'm sorry, he's insulin dependent, but he's also on dialysis. That's what I meant to say. So because of his diabetes, because Kay was afraid of the medical community, of what diabetes meant, he waited and waited too long. So that's my message, is to the advocacy world, is if you see someone who may be experiencing some symptoms of diabetes and they're not aware of it, or they're just so frightened that they're delaying care, please talk to them, because we know that diabetes can be lethal, that once you become insulin dependent, that you depend on that insulin to be alive.
Thank you so much. And Senator Sear?
Good afternoon. Thank you so much for having me. And it's so nice to be with my friend and colleague, Senator Lovely. We team up on lots of good things related to health and justice and children and families, and always good to be with Joan. So I've had people in my family who are diabetic. My paternal grandmother was diabetic and also lived with Alzheimer's, but really got, sunk my teeth into the policy challenges when I was working at the Department of Public Health. So prior to joining, being elected to the Senate, I worked at the Massachusetts Department of Public Health for 6 years, during a period where the state was really trying to do some excellent health promotion work. And so Massachusetts really has been a leader in healthcare. We were the first state in the nation to have universal healthcare coverage. And the statistics sort of bear out how well we've done there. But when we're really looking at the quality of people's lives, chronic conditions like diabetes are just so essential, that we do everything we can to, yes, manage these conditions like diabetes when people are living with diabetes, but then also prevent diabetes and other chronic conditions from happening in the first place. And so I was quite involved in what was then called the Mass in Motion program, which was a sort of statewide prevention initiative around making sure that we were doing all that good public health work around preventing chronic disease, including diabetes. And so that's really where my not only my interest, but really sort of focus in prevention and public health really crystallized. And now I'm serving in the Senate and get to work on these issues in a myriad of ways. I'm glad to talk about those further, but that's how I really got engaged in the topic.
Well, thank you both for all of your work that you do each and every day. And you definitely prove the point that diabetes affects us all in one way or another, directly or indirectly. Now, Senator Sear, you're currently sponsoring legislation related to step therapy, S756. Could you share a little bit more about the bill and how it could help people with diabetes?
Absolutely. So step therapy, also called sort of fail first policies, refers to a practice by health insurers of requiring a patient to go through certain medications, certain protocols around prescriptions that may deviate from what their provider, from what their doctor wants them to get, right? So your doctor may want you to have a certain medication to help manage your insulin or manage other complications around diabetes, but your insurer is basically saying, no, we need to basically test that the treatment that we're requiring you have to fail at that treatment before you can get the recommended treatment. And so that's a practice known as step therapy. It's something that insurers, both public and private payers, have been relying on and using for some time. I really believe that forcing a patient to go through step therapy can really actually lead to worse outcomes. Not only do I have a problem with sort of insurers interfering with determinations of medical necessity, right? Who's deciding what treatment a given patient gets? But it really actually can exacerbate and worsen conditions, including diabetes. Care for complex chronic illnesses, certainly doesn't come on the cheap. And we know that healthcare cost containment is something, particularly in a state like Massachusetts, we spend a lot of time thinking about. but I've really come in studying the issue that step therapy, I believe, actually adds costs to the healthcare system, because you ultimately are actually end up requiring people to say, all right, we're going to try this medication. By failing means, you get sicker, you end up in the emergency department. So the legislation that I filed, and actually the Senate actually took up this legislation last session. We passed it unanimously back in July 2020. There were very few pieces of legislation that we took up in the pandemic that were not related to COVID-19, and this was just a handful of those in the Senate that we took up and passed. And so we're hoping to get this done again now that we're in a new legislative session. It passed the Senate. That means we need to get it passed again in the Senate, which should be a pretty relatively easy lift. And then we need to get the House to take it up and pass it. Of course, payers, insurers oppose the legislation, but there's been a pretty robust coalition of patient advocacy organizations like DPAC, and also partners in research and science and in the biomedical community who are advocating. And so, we're cautiously optimistic that we can get this done and really make sure that medical necessity is being determined, by a provider and by a patient, and that we're not forcing people to go through what can be pretty retching, horrible experience of essentially being told, hey, I want to put you on this protocol. I want you to try this medication. But before we do that, you need to try these 2 or 3 other things that may not work for you, and that might actually make you sicker. And I think that's bad public policy. It's not humane policy, and so we're trying to make that fix.
Well, Senator Lovely, as a co-sponsor, would you like to add anything?
I just want to thank my colleague for filing this legislation. He is absolutely right. We see this in the diabetes world. We also see this in other chronic conditions, where again a condition can worsen as people go through different types of treatments. So let's get to the best treatment and not have that person suffer anymore. I mean, if you're ill, you're not feeling well at all. So you're going through a medication regime, trying to get to the best treatment, and you're suffering. That just isn't right. So I want to thank my colleague for filing this, that we passed in the Senate last session. I look forward to it passing again in this session and getting it to the House and to the governor.
Well, thank you both. Senator Lovely, could you speak more broadly to some of the health priorities for your chamber that impact people with diabetes and other chronic diseases?
Yes, absolutely. So again, we have a bill filed by Senator Saldi Domenico providing diabetes management in schools. This bill would include provisions for public school employees to be trained in the emergency administration of glucagon to students with diabetes, and be prepared to provide assistance to students experiencing hypoglycemia. Again, we want to be able to treat, especially students, juvenile diabetes, and the student in the school setting where they're not home. So to be able to have this to be able to be administered, we think is very, very important. The Senate also filed a bill which passed last session by Senator Friedman to have insulin be capped at a cost of $25 a month. Again, a life-saving medication. You should not have to rely on choosing between a medication. We see this all the time. We hear this is not unique to Massachusetts. This is happening all over our nation, where especially seniors will decide whether to fill a prescription or buy food or pay the heat. And we want to make sure and start here in Massachusetts that if you're insulin dependent, that is at a set cost of no more than $25 a month for your insulin, so that you are, because we know if you're insulin dependent, you're depending on that to be alive. So those are 2 bills that we've been working on. One bill that I filed last session and again this session is relative to premium impact statements, and so that insurance companies can't raise premiums unless they go through a complete review of how that premium will be impacted. So I really look forward to having that hearing again this year, because we know again that our insurance regulations and insurance companies really dictate how we are able to access our health care. And we want to make sure that that is really fair and equitable across the board.
Thank you. Senator Sear, as a member of the Committee on COVID-19 and Emergency Preparedness and Management, I can only imagine how busy you and your colleagues have been working on issues related to the pandemic. But it's been well reported that COVID has had a disproportionate impact on certain segments of the population. And in general, we call it, sort of health inequity. So how are leaders working to address this issue in Massachusetts?
So, COVID-19, whether in Massachusetts, we really had two sort of waves of the virus. There was a little sort of spike of the third here, but really through the entire pandemic, COVID-19 has revealed what were gaps and cracks that, but especially folks who do health advocacy work, who do public health work, who do health equity work, right, we knew about. And those have been revealed to be real gaping fissures. And when you look at who, you look at the morbidity and the mortality right here, who has been affected, and it's disproportionately people of color, people in immigrant communities, people who are essential workers, and that's true across the country, and it's true here in Massachusetts, which is a state, on a whole host of metrics, right? We really lead the nation, in insurance coverage and in our healthy outcomes, but the sort of persistent inequities that we have in our in our Commonwealth, particularly in certain communities, has really fueled just a real unacceptable series of outcomes. And so we've got actually a whole health equity task force. I'm actually one of the two senators who serves on that task force, and trying to go through a whole myriad of policies that really make a difference. A lot of this, though, is about a health in all policies approach, right? So yes, it's ramping up healthcare access. It's further relying on our community health centers, which have been so key to reach hard to reach populations. I think of I think communities like Chelsea and Everett and others in Massachusetts that were so disproportionately affected by COVID-19. I think in my the own communities I represent, in Nantucket and Hyannis, it's actually our immigrant workforce that has disproportionately had so much of the disease burden, so much of the suffering, the sickness, and unfortunately the deaths. So yes, we got to focus in the healthcare space. We also need to look at health and all policies, where you look at COVID-19 is transmitted most efficiently, and it has been in multi-generational households, right? That given, especially in Eastern Massachusetts, where the cost of living and the housing costs are just so high, you've got, in the communities I represent, you have 15, 18 people living in a 3-bedroom house, on parts of Cape Cod or Nantucket. These are the landscapers and the cooks and the waiters and the folks who work in hotels and motels, all the people that make Cape Cod and the islands, that welcome all these people, right? They make our economy happen, and they make that possible. They've disproportionately been affected. So when we look at health equity, yes, we're looking at specific policies that really expand access, really looking at cultural competency of our workforce, language skills, but we also need to be looking at health and all policies. And really in Massachusetts, our housing crisis, I think, has really contributed to and exacerbated the health inequities we've seen, in addition to a whole host of other factors that we don't have time to get into in the short time we have.
Okay. All right. Well, Senator Lovely, you've sponsored some legislation related to health inequity and the importance of measuring it. Would you like to add anything?
Well, what I wanted to add, I did want to just append on to what Senator Sear had said, that the pandemic has had a disproportionate impact on minority and low-income individuals and families. We know that all across the Commonwealth. We know that all across our nation. And so I did want to talk about the Patients First Act that we passed last session to improve access to telehealth. We have seen that it has had a huge impact on our healthcare system to deliver quality, affordable, and accessible care during and now after the pandemic. I've talked to so many constituents who are so happy that during the COVID, that they have not had to leave their home to access their health care. They've been able to get right online with their physician or medical provider to receive that health care now. But we do know that that does not happen all across our Commonwealth. We know in the western part of our state, there are still communities that do not have access to internet. They do not have broadband in some areas of Western Massachusetts. I know that's across our country as well. So that's something that we really do want to work on. And again, equal access to our to healthcare. Again, that premium impact statement that I had mentioned, as well as working on other initiatives as we go forward.
Okay. Well, I have sort of a question for both of you on just sort of health inequities, right? So the communities that you just talked about didn't just show up with COVID-19, right? And the health inequities also didn't just show up. So you're not the only state that's impacted by it, but what do you think? Do you think that we just missed it, had the wrong priority on it, or just couldn't get it, but now it's been exacerbated by COVID-19? And are you feeling like there's momentum and optimism to actually get something done in this area?
I mean, I would say, this is a manifestation of structural racism, right? This is exactly, these are, you can track, the redlining of 2 generations ago with the health outcomes, whether it be maternal outcomes, whether it be chronic conditions like diabetes, and then you can track that with morbidity and mortality, literally on a geographic basis of what's happened, right? So this is just another manifestation of structural racism, that's in our society. I think we've got to get real sort of granular and specific about how do we root this out. I think you need, particularly, I'm a big fan of community-based interventions, community health centers and other service providers that are really providing, culturally competent resources. I spent a lot of time thinking about transforming mental health access in Massachusetts. And you look at our providers, 90% of behavioral health, mental health providers in Massachusetts are white, and very few of them have language skills other than English. That is a major problem. 90% of Massachusetts isn't white, right? So we've got a lot of work to do in our healthcare delivery system, and then looking at everything from food deserts, transportation, the housing issues I talked to earlier. I think there is some momentum, but I do worry, as we're sort of coming out of COVID, and Massachusetts really is leading the nation in vaccination rates. We're really doing a good job here. Of course, it lags among communities of color, but those numbers are still all right. I do worry a little bit that in this post-pandemic bacchanal, people are gonna forget that, and we really can't. And we need to be very persistent here and stay at rooting out these inequities that I really believe are based in and stem so much so from structural racism.
Yeah. Well, I really appreciate the fact that you talked about some specific sort of focus areas, because all too often, sometimes we use the word structural racism to mean it is so big that we just can't get our arms around it. And to begin to sort of break that down into smaller, biteable chunks that we could actually make some progress on. So it's great to hear that. And Senator Lovely, anything you'd like to add?
I would agree with Senator Sear completely. I think COVID has shown a glaring light on something we already knew, but we were not addressing. I'm grateful to be sitting on 2 race equity task force committees, both in Salem and Beverly, addressing these issues, especially when it comes to healthcare. So we're drilling down at the local level. I think that's important to see how it impacts in individual communities locally, but it is a pandemic of itself that now has been completely, the Band-Aids have been ripped off, and we need to address it, and we need to fix it.
Well, thank you both for your leadership and focus and commitment on this very important issue, because it really does affect us all in one way or another. The last question for you both is, helping us understand what's the best way for smart advocates to help you and work with you and engage their representatives. Because often we hear just a couple of people writing and it can get lawmakers' attention. Is that true? Is that where we ought to be focusing?
Well, let me take a crack at this. I will tell you, in my office, we rely heavily on hearing from our constituents. We reach out to our constituents. I have weekly office hours to try to be able to engage people. We haven't been out as much in the communities over the past year because of COVID, but thankfully we have Zoom and other platforms where we're really able to engage. And I will tell you, we have sometimes, I'll be in a meeting where there may have been a dozen people and you'll have 60 or 80 people. This platform has allowed much more participation. I would encourage everyone who is listening and watching today, please reach out to your senators and representatives from whatever state you are in. They need to hear from you. We rely on you to let us know exactly what you're thinking and what direction you would like us to go on, particular to bills, particular to issues. And there's a variety of ways. You could call the office, you could email the office. We're all easily found on the internet. And you could find us through Facebook. We're all connected very heavily through social media, where we're trying to get our message out and let people know what we're working on. So whether it's Facebook or Instagram, shoot a tweet, whatever it whatever is your preferred method of communication, we need to hear from you. And please don't be afraid. I will tell you, way back in the day when I was in my 20s, I never would have thought, or 30s, never would have thought of reaching out to my state rep or my state senator. I just thought they were unreachable. Not true. So please contact us.
Yeah, Senator Lovely's spot on. I would just add, to make it personal, and actually Senator Lovely exemplified this when she talked about how she really became engaged around diabetes, right? She's talking about her constituent, Kay, right? Who's someone who she knows, who, she's that personal story. By making it personal, that's what really, legislators get pulled in a lot of different directions. And a personal story like that really can do a whole lot of good in sort of crystallizing priorities and moving policy. So be in touch, don't be shy, and make it personal.
Well, thank you so much. And it's so great to hear that message from both of you, because some of us think that, if we're not a big money donor, then nobody pays attention to our little voice. And so you're saying just the opposite, right? That all of those voices count and they are important. So Senator Sear and Senator Lovely, I just want to thank you so much for spending time with us today. Great information, and we so appreciate your support and focus and all the work that you're doing to help all people with diabetes. So thank you so much.
Thank you.
Now I'll turn our program back over to Julie.
Perfect. Thank you so much, Ed. That was really great. And thank you to our senators. As Paul mentioned, and I know we've said that they are so busy. This is a busy time in the legislature, especially, and we're grateful that they would take time out of their busy days to join us. So thank you, and thank you for that discussion, which sets us up so well for the next part of today, and that is an overview on all things Massachusetts government, from the congressional delegation to the state process. So you'll see on this slide, the Commonwealth of Massachusetts has 9 members of the House of Representatives, we're on state. I'll go there first. So you'll see here on this slide, actually, that Massachusetts is one of a dozen states where there's actually a split in political party. The state legislature is overwhelmingly Democrat, and you have a Republican governor in Charlie Baker. Also on this page is a view of the dynamics of both of those chambers. And Democrats have held majorities in both chambers actually since before 1960. So that's an interesting fact. And they have what's known now as a veto-proof supermajority in both the House and the Senate. So that means that if Governor Baker, a Republican, vetoes legislation, the House and the Senate have the votes needed to override that veto with just a party line vote. And if you're wondering who your representative is, you can use the link at the bottom to find your member if you aren't sure who that is. Massachusetts convenes for a 2-year session, and that just kicked off this past January. Lawmakers will meet all year long on the issues, and they work full-time as legislators. And both senators and representatives are reelected every 2 years. So everyone is up for reelection in 2022. And because Democrats have a major advantage in number, there is some agreement among some of the hot button issues in the majority, but that does not mean always. So These dynamics are important in understanding the odds of a bill passing. Those of you who are, actively monitoring legislation, perhaps in the midst of your busy lives, can notice that if a bill is sponsored by a Republican that you're looking at, it's going to need some Democrat support since you need a majority of votes to pass legislation. So you can look up bills online for the Massachusetts State Legislative website and do a little homework yourself, see who the sponsor is, see who else might be supportive. The number of co-sponsors often indicates support because it's legislators who are willing to add their name to a piece of legislation because that's how strongly they support it. You can also see where a bill is in the process, and that actually takes us to our next slide. We are going to talk briefly about the congressional side of things, even though obviously today our focus is on state. Commonwealth of Massachusetts has 9 members of the House of Representatives, and like every state, 2 senators. And again, if you're not sure who your representative is, you can use the link at the bottom of the page. And we'll change here now to talk a little bit more about the process of how a bill becomes a law. And the nice thing is this is pretty similar for Congress and the state. So sort of shifting gears back to the State House here, and you see their bill on the page from Schoolhouse Rock. It is hard to look at that and not start to sing the song, which is actually quite informative. So in that song, Bill notes that he is one of the lucky ones because most bills never get as far as he's gotten, and that's accurate actually. Some 14,000 bills and resolutions were filed in the 116th Congress between 2019 and 2020, and approximately 90% of them received no action. So they didn't get a committee hearing, there was no discussion, no vote, and Congress is designed in some ways to move more slowly. It also can be really hard to follow because bills are combined into these giant bills called omnibus bills. But the exciting thing about state capitals is that they see a lot more action and they're easier to follow. So on this slide, you'll see the steps of a journey that a bill takes from when it's filed all the way to when it's signed into law. And each color shift shows the time when advocates like you can be involved and really make a difference. So at the start, advocates could even work with a legislator to file a bill, a piece of legislation. And then once that is filed, it gets assigned to a committee based on its subject. So it might be health, and a lot of diabetes bills are heard in the health committee. But it could also go to another committee like education, for instance, if it is a glucagon bill, or it may go to a budget committee if it requires funding. And after the bill is assigned to committee, it may never again move. Sometimes we call on advocates to contact committee members and committee leaders to see that the bill is actually heard in committee to move forward for a vote. And sometimes we're even able to bring advocates into the committee to testify and tell their story on a bill, and that's another way champions can be involved. If the bill passes out of the committee, now there's even more advocacy needed to make sure that it gets passed because it's before the full chamber. So that means that we're writing in at this point to representatives or senators, whichever chamber it's in, and asking them to vote to pass the legislation. And then this process begins again in the following chamber that it goes to. And that's all the way until Governor Baker gets it, at which moment we could either appeal to him to sign the legislation, or if we are opposing it, to veto the legislation. So there are lots of moments when hearing from you, the people back home, the constituents, is going to make a big impact in this process. And DPAC will help you find ways to use your voice where it matters most. So the next slide, it just has a few next steps on it. Sign up for our website. Here's our social media. Spread the word, recruit advocates and people you know to join this advocacy army to make sure that lawmakers are acting in the best interest of people with diabetes. If we could sum it up in 3 words, your voice matters. And I think George really just drove that point home. So thank you so much for joining us.